So right from our previous segment, we've heard from our viewers about their experiences with emergency services across the country. And now we turn to a deeper discussion on the implications of systemic gaps that continue to plague Nigeria's response system. Now, every year, Nigeria loses billions of naira and countless lives because emergency services often arrive too late or sometimes not at all. The socio-economic impact is enormous. Businesses are wiped out by fires because fire trucks have no water. Communities are cut off during floods, leaving families displaced and livelihoods destroyed. Road accidents, which kill over 6,000 people annually, rob families of breadwinners and place a heavy burden on our health system. Now, beyond the immediate loss of lives and property, poor emergency response reduces productivity, discourages investment, and perpetuates poverty in already vulnerable communities. So, what does this mean for national security, for economic stability, and for ordinary Nigerians? And more importantly, how can these systemic failures be fixed? So to help us unpack these issues this morning, we are joined by Dr. Daniel Obot, the former Director of Risk Reduction at NEMA, and Dr. Okonokhua, Program Manager of the FCT Emergency Medical Services and Ambulance System. Gentlemen, thank you for joining us this morning.
Thank you for coming.
For having us on this program.
Absolutely. All right, first off, I would ask an overview question. I'll direct this to you, Dr. Ozzy. How would you define the current state of medical or emergency response in Nigeria, the infrastructure in general?
All right, thank you. In response to that, I would say the emergency medical response in Nigeria is on the increase. It's improving. Before now, I know that there was no concerted effort to provide emergency medical response as a program to the people of the Federal Republic, but since 2022, there has been an initiative to see how Nigerians can actually access emergency medical response, across board. And some states have started implementing this program to the extent that medical services at the emergency level are provided free of charge to Nigerians when they call a dedicated number. The number that has been constantly branded is a 112 number, where Nigerians can actually call and access, emergency medical services.
Doctor, not to cut you short, that particular number that you just called, right here in our studios, we tried contacting that number, but a lot of people have said that it is always switched off. So what is your response to that?
No, I wouldn't say it's always switched off. It's a line that is perpetually open, run by the Nigerian Communications Commission. Now, in addition to that, to avert such, because it's one number, and that number takes all levels of emergency responses, whether it be medical or fire or everything. So it's overburdened. But there are people who are triaging that at the Nigerian Communications Commission level. However, different states have also adopted different numbers. That is, that they use to respond to medical emergencies. We have a dedicated, number in the FCT for which you can call and get emergency medical response. Not just conveyance of patients from point A to the hospital. The scheme runs in such a way that you get treatment free of charge for the first 48 hours in designated hospitals in the FCT. So that's what we are doing. At least I can speak for the FCT. Maybe nationally, other states are also running it. And the National Emergency Medical Service and Ambulance System, run by the Federal Ministry of Health, is coordinating this whole process to ensure that Nigerians have access to quick and rapid emergency response.
All right. So, Dr. Daniel Obot, as the former Director of Risk Reduction at NEMA, what are the steps that have been put in place to make sure that there's a quick response whenever an emergency arises? And how do people get to contact, for emergency response? Or does this emergency has to be reported by one avenue or the other to NEMA before they respond, or personally people can contact them?
Thank you for the question. It's very germane. One of the issues on emergency response and efforts that have been undertaken over the years is, first of all, the mobilization and coordination of stakeholders. What is happening is that, for instance, if there is fire incident, immediately NEMA is reached. We will alert Federal Fire Service as the first responder. But with NEMA, will mobilize the search and rescue officials from the search and rescue unit to the scene. If it happens that Federal Fire Service has not yet arrived, any institution that has been there will have to try to make effort to provide basic services. Immediately the first responder arrives, there will be handover to those that have the special skills. If it concerns maybe medical or health issues, NCDC, based on the health situation, will be alerted, or Ministry of Health. So immediately NEMA gets information on a particular incident. If it involves it mobilizing its resources, that will be done, and then NEMA will get across to the statutory institution that is assigned to handle that responsibility. They will work in a teamwork approach until the incident is stabilized.
All right, I want to ask Dr. Ozzy, you rightly explained how, the emergency service work in the FCT, because of course you have, more, route here. So I would love to find out from you, what are the major challenges? Let's start with, the experience you've had in ambulances. What are the major challenges you encounter when there is an emergency?
From the level of infrastructure, I will start from there. Basically, the biggest challenge, of course, is infrastructure. That's because we don't have the requisite number of ambulances to cover the whole of the Federal Capital Territory. And it's not just FCT, across board. And then, secondly, you also have road infrastructure. There are some places that these ambulances cannot get to. And that's why, for now, it appears as if we're covering primarily the urban centers. The rural areas are waiting and begging for attention, because you can't, emergency is no longer quick response where you cannot get there on time. So you must get there on time, because there's a golden hour during which you want to save the life of a patient. So that's another issue. And then we also have the issue of what I want to call the attitude of bystanders or good Samaritans. In an attempt to help, oftentimes they complicate the situation of the patient on hand, which you cannot really rule out. Everybody wants to be of help. But the process of helping must be handled by those who are trained and knowledgeable in evacuating patients from, for instance, road crashes. You don't want to move a patient who has some spinal cord injuries, and then at the end of the day, you complicate the life of that, that particular person. And that's why I'm happy that NEMA is also able to triage, because for emergency medical responses, we are not trained to evacuate or rescue. Ours is to really administer medical response, first aid on ground. We don't have the wherewithal to be tearing a vehicle open, to be, cutting metals. We come with trained personnel who simply, after the patient or the victims have been rescued from the scene of the accident, were it to be a road traffic accident, that is when you now start administering first aid, right on the spot, and then conveying to the hospital. So those are the basic challenges that we face. And of course, you cannot rule out the fact that we are beginning to experience a lot of shortage in terms of manpower, occasioned by the rapid movement of healthcare professionals across board. So it's already beginning to impact all the levels of healthcare delivery, nationally. So that's another issue that needs to be addressed. So basically, we have, infrastructure, both in terms of ambulances. We have infrastructure in terms of road architecture. We also have the attitude of, bystanders in response. And then, you know, again, we have also noticed now that instead of persons to respond quickly, you have people taking pictures and recording videos of, you know, victims and posting it online. It may sound good, but this person needs help there and then. And so we also are looking at how to empower the average Nigerian to be able to administer life-saving first aid on the spot, you know, such that you don't need to, you should become useful, you know, on the spot to the patient who is, you know, facing the challenge there. And we also have issues about, even because we're talking basically as if the only emergencies we experience is on the road. We have experiences at home, I mean, emergencies at home as well. So a lot of the time, you find that by the time these patients are seeking for help, there's so much time lost in, you know, in delays, in assessing, making attempt to call out for help. So usually some home remedies, home hacks, you know, administered, which in the long run does not help the patient in most instances.
So for the infrastructure and the ambulances in the FCT, I mean, we're in the FCT, I mean, it's what we know. Can you give us an estimated number of, let's say, like how many ambulances we need right now in the FCT to help with, you know, the emergency services?
Okay, it's difficult to estimate that number, but I will tell you that as many as possible. So what we are doing, for instance, in the FCT Emergency Medical Service and Ambulance System is to leverage on private sector participation. So government on its own cannot provide all the ambulances. So what we do is to leverage on those in the private sector who have ambulances, whether it is owned by hospital or it is owned by private ambulance service providers. So we use a network of these ambulance service providers and coalesce them into a central database, so that wherever you are, regardless of whether it's public or private, once we're able to reach out to you to the nearest location of the where the call for help is made, we dispatch an ambulance to that particular location, regardless of whether it's public or private, so that we can actually, you know, move such clients or victims to the nearest healthcare facility.
Okay. All right, Dr. Obot, we know that there are different emergencies that do occur when it comes to healthcare, when it comes to, you know, fire outbreaks as well, environmental crises as well. Just of recent, we saw a very huge fire outbreak that happened in Lagos State, and there's a lots of back and forth when it came to your emergency responses, and a lot of people, even from the callers that we got earlier, that when it comes to fire response, there usually is a delay when it comes to it. So what bottlenecks do you think exist, you know, in fire service infrastructure when it comes to the equipment as well, and training when it comes to responding to those emergencies?
Concerning fire outbreak, some challenges in that area. First is that when there is fire outbreak, if people within that locality do not give out information to the responders, it will be a little difficult for deployment to be undertaken immediately. Another thing is that improper planning, because even if, for instance, fire service will mobilize their equipment, the road or the street might be narrow, so getting access to the scene of the incident becomes a problem. And in some cases, probably the fire service might not have been fully mobilized in terms of having adequate water for their equipment, for their vehicles to move down there. That becomes another problem. So, and sometimes the building structure, high-rise building in Nigeria, do we make provisions for responders to be able to access maybe 5th floor, 6th floor, if there is an incident? So to me, inadequate planning in terms of the layout of the area, in terms of the facilities provided at the buildings in case there will be emergency. In some cases, there will be no muster point in some institutions that people can move and assemble there. In some cases, there is no fire alarms in some of these institutions, because in some cases, if something happens, there should be alarm, and inadequate training, in-house training to mobilize, to educate, build that knowledge into the staff that if you hear this particular sound, know that there is danger, you have to move out. So inadequate in-house training is another problem, inadequate planning, another problem, insufficient equipment by the responders, and getting information to the responders also contribute to some of the challenges that lead to loss of life, damage to infrastructure, and other things associated with economic impacts are also there.
So, Dr. Obot, many argue that the rural communities are always, the ones that face the heat the most when there's an emergency issue, because they don't have access to these emergency services and what have you. So, how true is this, and what kind of inequalities are we seeing when it comes to, the urban area and the rural area in terms of, giving these services to people?
The differential in understanding and knowledge in urban and rural areas is wide. And rural areas are places under the control of local government areas. State government also have to be involved. NEMA on its own has tried to establish community-based disaster management systems. We have what we call volunteer groups in the communities. We have what we call NYC emergency vanguards, that when youth corps members are in the camp, NEMA move in, get the permission of the camp management, and have some youth corps members to be trained, so that when they are being deployed to their primary position of assignments, they can help the rural community to undertake, have the knowledge of this. The major challenge is that some state governments have not established local emergency management committees, because it is these local emergency management committees that will be the platform that the rural community enlightenment, education, awareness creation will be based. Because when NEMA will do it at the community level, we have to hand over to the local government, the tier of government that is closer to the people. Some state government even do not have state emergency management agencies. So if some state government do not have state emergency management agencies, you cannot that state to have local government, because the establishment of the local government committee, management committees, is the responsibility of the state emergency management agency to make disaster management in more or less a relay exercise. If NEMA will deal with the state should directly deal with the local government that handled community disaster-based management systems. So that is one of the challenges that NEMA is trying to address, getting that state have state emergency management agency. Some states, some have only 1 or 2 staff in a particular ministry or in the office of the deputy governor. And what they are specializing on is waiting for disaster to happen, then call on federal government for relief materials. After getting the relief materials for the distribution, that ends. The disaster risk management is not handled at the state level. I can mention Lagos State is doing very well in terms of the disaster management. Kano State has structure, Kaduna State has structure. I think Delta has a structure. Others, you have maybe 1 or 2 officers in the deputy governor's office, 1 or 3 officers in Ministry of Special Duties. So in such a situation, the risk management is lacking in these states.
All right, Dr. Ozzy, when it comes to, I wouldn't say preparedness or standards, are there clear national standards or regulations that are guiding emergency preparedness, or is the system reactive and fragmented when it comes to having a whole system put together?
For medical emergencies, we operate under the auspices of the National Emergency Medical Service and Ambulance System. So there's already an established structure that we're using to respond to medical emergencies across the nation. Yes, some states have not really keyed into this scheme, but FCT since 2022 has been operating the SEMSA structure, which is the State Emergency Medical Service and Ambulance System. And that system makes provisions for every state to be ready for medical emergencies. What may happen, what you may experience in some instances is lack of awareness of this scheme. A situation where there's already funding for evacuation of clients from one location where the incident happens to the nearest medical center at no charge to the patient. And then there's also the treatment for the first 48 hours, still at no charge to the patient. You find that with that system in place, nobody should actually, be facing any form of medical emergency challenge. So all the barriers have been removed. But yet there's a lot of awareness that needs to be created. And that's why we'll need the media to support us in this scheme, to inform the public about this service that is readily available to every Nigerian, regardless of religion, creed, or political affiliation. Another thing that I've also come to realize is that with the level of preparedness that we have, there is still a lot of room for improvement, because as of last month, the number of hospitals that have keyed into this scheme, we find that principally government hospitals, in the FCT, all the states, all the general hospitals in the FCT, whether you're in Kwali, Kubwa, Abaji, Robochi, Maitama, Wuse, Asokoro, Nyanya, they are all part of this scheme. So any patient that is conveyed on the platform of medical emergency service is not expected to pay anything for the first 48 hours. So we are calling on those in the private sector to also open their doors, after some level of accreditation, because it's not just any center that can provide emergency medical services. So we do some accreditation and confirm that this center is readily capable of providing such services. And then we onboard them, just as we do for private ambulance service providers. We also need to be sure that it's not just an ambulance that is labeled, it's not a vehicle that is labeled ambulance, but it's actually able to provide services at least for the first 1 hour in the event that you're not able to get to the nearest healthcare facility. So those are some of the things that are actually working. So to answer your question directly, there's a structure in place, under the National Emergency Medical Service and Ambulance System.
All right. Dr. Obot, you made mention of states that, are doing well when it comes to emergency response, but do you think in Nigeria we are just tailoring solutions that are unique to Nigeria's geography, population density, and informal urban settlement, or we're just copying Western models that don't really fit?
No, what we are doing, there is nothing wrong in borrowing ideas from other countries, but you modify to suit your environment, to suit your circumstances. So the issue is emergency response, as I said earlier, should be more or less a relay activity, because maybe the national medical management cannot be in Abuja and know what is happening in a particular local government. Let me say my state, in Akwa Ibom State. There should be a structure that when you hear something at the national level, you immediately link with the focal person at the state. What is happening here? Then the focal person at the state link up with the local community. But in instances that we have a large-scale situation, NEMA will set up what we call EOC, emergency structure, at the state level that will be on ground to get information and send to the national level. that will enable coordination of resources, have the statistics that will make a case for intervention. So what we really need is having strong structures at the other tiers of government. The political will by the chief executives of the states should be there to see that disaster management has a nexus with the development of that state or any area. Because if a disaster happens, your investment that you have put in almost 100 million naira can be wiped in a second of an incident. So there should be integration, mainstreaming of disaster risk management into development plans, governance at all the levels of the government in Nigeria.
I know that everyone that's watching would want to know, with emergency responders, are the equipment and the people that provide these responses, are they up to par when it comes to training as well as the equipment as well? Are they updated? Are they the ones that are meant to be used when it comes to service? What does it take for an ambulance to run? Are they properly equipped? Are the paramedics properly trained as well when it comes to the fire service? Are the fire trucks updated, up to standard? Are they easily accessible, or is water easily accessible to them? Aside from that, are the firefighters properly trained as well? So a lot of people want to know if they are they are properly prepared, as well as can provide the quick response that they need to respond to. I'd like to hear from both of you.
Okay, in this particular issue of training, individual institutions, I should say, must make a provision for training, building capacity of the staff that are at the front line of responding. For instance, in NEMA, between 2010 up to 2020, when we realized that Federal Road Safety Commission was not sufficiently with ambulances, NEMA bought ambulances, give them to Federal Road Safety Corps. Nigerian Security and Civil Defense Corps was also equally provided with ambulances that were purchased by NEMA. So the inadequacy of facilities by institutions that are responding are always being discussed at what we call coordination forum.
All right.
So that at that forum, NEMA will look at their challenges and also leverage on what other institutions have.
Right.
We have an MOU with the Julius Beja that if there's serious road block or road accident, Julius Beja should come in.
Dr. Obot, I'd like to quickly hear, before we go, we'll be going now, so I'd like to hear from Dr. Ozzy quickly in a few seconds, if I can.
All right, I'll try. In the first instance, yes, the FCT Emergency Medical Service and Ambulance System does organize trainings, regularly to beef up the capacity of first responders. We also leverage on what's already on ground. Working with, place institutions like the Red Cross or the Ambulance Academy. Just about a week ago, we did a capacity building for the staff of the FCT Emergency Medical Service and Ambulance System to also equip them on their ability to respond to emergencies. For the ambulances, the ambulances that we use must meet some minimum criteria before we can actually onboard you. It's either you're an advanced life support ambulance provider or you're a basic life support ambulance provider. So we know the ones we know where such ambulances exist, because we also try to geolocate them so that at the right time we're able to call on these ambulances and then be able to leverage on their capacity. Just to quickly, just 1 second.
Out of time.
All right, that FCT is already operating on a structure. We don't rely on the NEMSA structure. All the calls that come for emergency medical response come directly to the FCT, and we deal with it at the state level. So NEMSA is just a coordinating body.
All right. Thank you very much, Dr. Daniel Obot and Dr. Ozi Okonokhua. I hope I pronounced your name.
You did very well. I'm
Right.
surprised.
Thank you very much for being here.
Thank you for coming.
And, unpacking a lot for us here.
Thank you for having us.
Thank you very much.